All right, here we are on the shoulder. My pointer is pointing up to the bone, the acromion, the undersurface of the shoulder blade. And now this is the end of the clavicle at the joint between the shoulder blade and the clavicle. And you can see that that bone is coming down and it is touching the rotator cuff. And you can even see where the rotator cuff has been frayed as it moves across the bone spurs. So then we go in with a 4mm shaver, or actually a 4mm burr, and you can see I'm resecting bone from that undersurface, and the whole goal is to create space so as the shoulder is moved about, there's no rubbing of the rotator cuff on the bone. There's suction attached to this, so all the little particles are going into the suction device, and again, we're just creating space. This individual patient has had about 5 to 7 millimeters of bone removed to create a total space of about 1.5 centimeters. I've now resected over to the clavicle, to the end of the collarbone, and now I'm taking out the undersurface of the clavicle, again to create space for the rotator cuff. Once we finish removing bone, we then shave the undersurface, taking out the actual AC joint. This patient has arthritis in the joint. The spurs have been removed, and because these two edges of the bone will actually touch each other, we remove that joint as well. That's not done in every patient, but done in patients with arthritis of that joint. Now the resection is complete. There's probably 12 millimeters of space. I'm now probing the rotator cuff to make sure there's no full thickness tears, but you can see how getting the bone away from the rotator cuff will protect it in the future so that the rotator cuff doesn't go on to any complete tear.